Happy
Morning.
Thursday.
Afternoon.
Hi, Lisa. Canada is in the house. Lisa is is it Vancouver Island, Lisa?
I'm from Vancouver, BC.
Yeah. And you're doing such great work in Canada. We can only hope to emulate what you're doing, because Canada is really taking family council seriously and working with them.
Yeah, I just got off a call with our University of British Columbia research team. They've been researching resident and family councils for this past year. There's 2 different funded research projects coming to a culmination May the 1st. That's very soon. And so they're sharing with me because I've been a research partner, and I'm extremely excited to be able to soon share the work that they have done.
Oh, nice. Thank you. Thank you for doing that. Everyone else, I noticed there are some people off camera. If we can gently, softly, lovingly encourage you to turn on your cameras, it makes for a better experience for everyone. And we get to see your smiling faces just like you can see ours. So please feel encouraged to do that. It always helps, but we understand if you can't, not to worry. But thanks for joining us, everyone. We're recording right now. Okay, so everyone, welcome to April's Family Council Empowerment Hour with my esteemed colleague, Gloria Murray, and me. I'm Janine Ferrari. We are with the Long-Term Care Community Coalition's Family Council Empowerment team, and we've been working with family councils throughout the United States. We met recently with the Ombudsman team for Guam, Puerto Rico, and Hawaii. So the reach that we have is extensive, and we just met with Canada. And if you saw us talking to our colleague, our sister in arms here, Lisa Dawson from Vancouver. And today we're going to be talking about the challenges, the highs and lows of forming and maintaining a family council. We've heard from many of the people that we work with. The family council members or people who are trying to start one, the challenges that they're facing. And we want to talk about that because we know that when you meet other people who are experiencing the same things you are, it just makes your experience, it validates it. You don't think you're going crazy if other people are experiencing the same exact thing. We want to talk about what success means to you, what success means to your family council. And these can be small things. These can be things that make a difference in the long-term care residents that you're working with and that you're an entity of. What do you think, Gloria?
Great. I think we want to give Richard the spotlight for just a few seconds to bring us some breaking news.
Hi, thanks, Gloria, and thanks, Janine. So I just wanted to mention, I think everyone probably has heard this, that the Biden administration has released final rules for staffing standards in nursing homes. It's the first time that there's ever been a numerical or quantitative standard for staffing. There's a few good things about it. For instance, 24-hour a day RN staffing. However, there are a lot of things that we're concerned about, including a very low overall staffing level, the availability of facilities to get waivers on for the requirements, very delayed implementation of the requirements from 2 to 5 years, depending upon where the facility is located, and there's really very weak enforcement mechanisms to make sure that facilities actually meet those standards. So we have a number of concerns about that and unintended impacts. Haley just posted in the chat that we have our new, we did a brief on it, and we have information on the rule as well as access, to staffing for every nursing home in the country that is in compliance with federal reporting requirements for staffing. So we provide that information, and you can find out if your facility or the facilities in your community are currently meeting the standard. Thank you both, Janine and Gloria.
Thanks, Richard. Important news.
Richard.
Absolutely.
And just one more
Okay.
thing I want to note on that, on the link that I put in the chat, there's also on the purple boxes on the right hand side of that screen, you can access the staffing data as Richard mentioned, and then the second box is the staffing rule if you are interested in reading it. It's almost 400 pages, so don't feel pressured, but it is there for your use.
Thanks, Haley.
Thank you. Thank
All
you.
right, Janine. So let's get talking about family empowerment today. And our topic really, we want to talk about success and what success means to some of the family councils that are out there and having their peaks and valleys. But how are you measuring the success of your family council so it keeps you motivated, it keeps you moving up that hill, right? Because we all have those peaks, we all have those valleys that we get into, but there has to be something in your mind that is successful that keeps you moving upwards. So we just want to maybe hear from a couple of people who already have family councils who'd like to share with us like what they're looking at for success and what they're measuring their success on to keep going with their resident council, with their family council. We do know your challenges, as Janine said earlier. We know what we've heard your challenges. We know we experienced them. Janine has. I've listened to families over time. It's challenging to get people to stay interested. It's challenging to, get new people. We know. So that's why we want to focus on some of your successes today, because I'm sure you've all had some, whether they're small or monumental. They're still successes, so we need to take them all and say, great job. And just would like to hear from our audience and anyone who wants to, tell us a little bit about their successes and how they feel it's making them have the momentum to keep going. And then we can also talk about anything else that comes up on your agenda or your minds. Liz,
I see. Go ahead. Yeah,
Liz,
I was going to
see
say
you
Liz
on.
Stern.
I don't know if you want to share or talk to us or give us a little. I know we had a conversation earlier in the week, or last week. I don't know. My weeks are all running in together, but it would be great to hear from you with your successes and what you're doing. And
you'll have to excuse me. As I told you earlier in the week, I have a house full of company, and some of them are 6 years old and 8 years old. So I'm going to just jump on and say thank you, Gloria, for your impromptu support this week. And you know what my challenges are, but I will emphasize the support, and the support is something I didn't expect. Just speaking casually with people, and then coming back and hearing, just in casual conversation I've had with people, because I know the facility that my father lives in so well for 8 years, information that I take for granted and just comes up casually in conversation, I don't realize how valuable that is to people who are new to the game. So we had an event this weekend, and someone just piped up. My mother is so happy now. She moved from assisted to independent living, and I didn't know you could make changes in that direction. And in our small group, that information was imparted by me just very casually, and 2 people have moved so far. They've gone from assisted to independent. The other success, because I think it's important that those people who are listening know that I have a family council in a managed residential community. It's assisted living, it's independent living, it's and memory care. It's not a nursing home. The other success I can say is that residents are recognizing that there's a family council, and there are residents who could be my neighbors in my my neighborhood. They're in their early 70s, middle 70s, and there are even some very fiercely independent people in their mid to late 80s, and they're noticing what's happening, and they want to become involved, and they want to share their talents. And I didn't expect that, but we're embracing it. Absolutely.
Liz, thanks. And I do remember you saying you have your wonderful company there. That's
Yes,
Six
and
and under,
that's
so-
why I'm on mute, and I'm listening. So if you call on me, I'll participate, but I'm going to choose to listen and not. Okay.
I totally understand and appreciate you being here. Absolutely. But
All
those
right,
are
thank
great
you.
Thank you,
successes.
Liz.
Thanks.
And there's small successes, but they're huge successes because
Yeah.
you're reaching out to someone, to everybody, and everybody's becoming more
Mhm.
aware. So I think that that's the success you want to look at, as the awareness that this is happening. And another great point you had was residents. I guess, and I think when there is a family council, residents do become aware that there's a family council. And I think it's important for family council to make the residents aware that there's a family council, and this is what we're working on. Tell me tell me your perspective. What's going on, share with us. Of course, we did, and in our impromptu conversation, we talked about not having the residents think that the family council is their new resident council, because you always want the residents to have that resident.
That's
right?
going to be, that will be a very welcomed challenge. That's all I can say. I'd rather have it that way than the other way. So I welcome that challenge.
Yeah.
Thank
great.
you. I'm going to go off
Thank
camera,
you.
but I thank you very much.
Thanks, Liz.
You
I
bet. Thank
appreciate
you,
it.
Liz.
Yeah, so that's some great points, Janine, that Liz brings out, just the awareness, just talking to them, supporting each other, educating each other. Those are all successes that maybe, don't always get looked at on the bigger picture with the challenge of building the family council.
Yeah, because you're so used to doing that, it's just part of your activities whenever you're on the premises. But it means a lot to many people. It means a lot. They don't get talked to. They don't get recognized. That's part of the magic and the power of a family council. Making it personal, making a visit personal, and being there for as many people as you can. I think Lisa Dawson had her hand up, our friend from Vancouver.
Thanks, Janine and Gloria and Richard, for inviting me here today. I feel so warm and fuzzy being amongst my fellow family council people. And my role, in addition to being chair of the family council in my dad's care home, is also being the chair at the regional level. We have a mechanism of elevating the family council voice up to our regional level. We have 5 regions in British Columbia. And so we have 5 regional associations of family councils who work together at the provincial level with our Ministry of Health to discuss systemic issues and how we might go about chipping away at improving continuous quality improvement in our long-term care system in British Columbia. But back to the family council level. Ironically, one of my colleagues in a different region right now is having a meeting to brainstorm on a document that actually addresses this exact topic of how can we better sustain, maintain, and grow our family councils in long-term care when we know that there is a consistent challenge of turnover, burnout, unavailability, families living far away, et cetera, et cetera, et cetera. So how can we still do this and achieve what you call success, one point measured by sustaining and growth, but the other is just the success measure. What are the measures? And so this is great here today to be talking about them. One measure that we always talk about is, does every family member that comes to the meeting, do they feel better when they leave the room? So we really want to, we have a code of conduct that we use. I'm sure you all have something similar. That really defines the kind of feeling our meetings, our expectations in our meetings. So rather than blaming and complaining, how do you shift that emotion of what you're trying to explain to everyone into something that's positive? And we use a technique called appreciative inquiry, so that our members really begin to learn how to talk about the blue sky they want to reach rather than the situation that they have found themselves in with their residents. So this is one sort of technique that we've been trying to use slowly and roll it out amongst our councils. But the other measure of success, going back to that, is are we really meeting the needs of our residents? I mean, because of course that's what our conversations are supposed to be about, is how can we continuously talk about ideas and projects and improvements for the sake of our residents. And one way we found is to be consistent about our touch points with our resident council. That doesn't have, when I say consistent, it's not a monthly thing, but it's like, are we sharing our minutes? Are we actually at the beginning of the year mapping out what we're doing for you? For example, our family council this year said, okay, resident council, what are the big things that you are trying to achieve that is either not in the budget of the care home or just falls short of being a priority? And they talked about rejuvenation of the libraries. We have 2 libraries, and they are old and decrepit, and actually there's empty shelves, and anyway, it's a mess. So, you know, that we're having a book drive, and we gather the information from the residents, you know, what kind of books are appropriate, what kind of books are can be wiped down, you know, so not paper book backs, not newsprint, and things like that. And, you know, let's be careful and mindful of our subject matter, but certainly anything to do with travel and nature and, you know, even recipe books are great because they're full of colorful pictures that remind you of the days of yore. Anyway, that's really what I wanted to share with you, is that we're experiencing and going through exactly the same thing as you, and the same topics. And the UBC Research Group has developed an unvalidated but extremely useful tool for family councils as a result of their research that isn't quite out yet. Like 5 days from now, it'll be out. And this tool is a measure of effectiveness that all family councils can use. It's like a little survey that you use to send to your families. And I'm happy to share that when it's released, because I think it is a great idea to survey your members.
Absolutely, I agree with you.
Yeah, thank you
Lisa,
for that, Lisa.
Yeah, that's great information, especially on the measures, but I see so many successes there too, you know, like just the success of involving the residents, you know, getting to, and the family council using that to plan their year and what they're going to do. You know what I'm saying? Getting their input as to what they think they need. And sometimes it's not always related to the care. Sometimes it's more related to the spiritual or the mental, right? The outlook, how they feel, and they always want to feel like they're needed and that they still can contribute. So I think that in itself is a huge success for the residents that you're working with, and the family council should look at it that way for sure. Thank you so much, Lisa, for sharing that. Definitely.
It's fabulous. We're so excited that we can count you as part of our advocate team here in the United States. So thank you for that, Lisa. And we're looking forward to that report as soon as it's ready.
Yeah.
Gloria, we have a number of ombudsmen on today, and I'm wondering if any of them would be feel comfortable coming on and just telling us about what you are experiencing with the family councils in your regions.
That would be great. I would love to hear from some of the ombudsmen, or even, to hear what they're doing and how we might be able to help them or assist them with their challenges, or to start family councils or get interest in family councils.
I think Angela is an ombudsman. So Cynthia and Bruno, if any of you feel comfortable coming on and talking to us about what's happening, we'd love to hear. Bruno,
It's
Hello
Angela.
there.
Hi.
Angela.
I'm
Hello.
not an ombudsman anymore because my sister was admitted to the facility I was covering. So I am now co-president of the family council, so that I'm still involved, but I don't have the power of the ombudsman. However, since everybody knows me from being an ombudsman, it's really helpful.
Mhm.
Our manager of ombudsman in our territory, our area, comes to our meetings with us. So that's important. And I've talked to the president of the resident council also. And she is interested, but she feels a little, I know, I kept inviting her to come to the meeting and it was like, I don't know. But our issues are more, we're very small, and we're all having trouble getting off of the complaint session
Yeah.
piece. And I was just interested in something that somebody said, our last person said about code of conduct.
Mhm.
I mean, we have a few in our session that make me very nervous, especially when we have speakers from the facility. And I'm not real comfortable how they're addressing like the director of nursing. And I would really love to see a code of conduct from somebody.
So let me,
Mm.
go ahead, Gloria.
I think that, yes, I'm sure that we can share codes of conduct, or anybody could share, Lisa could, or whoever. But also, I think it's important in growing your family council is address that with your family council if you haven't already, and pull them into it and say, okay, as a group, we need to establish a code of conduct, because we're all adults. We're all here for the same purpose. We're here for our family members. We're here for the residents. We're all here for the same thing. So let's pull together and develop a code of conduct. To get their buy-in is a whole lot better than to take a form of a code of conduct from somebody, or just a form of a code of conduct. But
Mhm.
it's more energy, and it's more involvement, and it's more being part of the family council and they all have a buy-in to grow it, because you all want to discuss the best code of conduct. Everybody might, have a different idea, but also it
Right.
brings an awareness to the fact that, kind of like what Lisa said, they used a little bit of that measure of, looking at appreciation, an appreciative inquiry versus the complaint. That's something I really would like to, explore more, because I think that's great. Always looking at the positive side before you start talking about the negatives. But that might become a part of your code of conduct. But I just say, pull in those families that are there, even if it's only 5 of them.
Mhm.
5 rules. If the 5 of them show up for a family council meeting today, and we're talking about code of conduct, and they're all giving you the information to, yeah, we need to do this, and we have to limit that. Okay, great. What's our code of conduct going to be then? Those 5 are now developing the code of conduct. End of story, right? Majority rules, majority's 5 of us are here. We're going to develop the code of conduct. But I think it's a great idea just to reach out to those family members, let them know that we're going to
Yep.
establish we're going to establish a code of conduct. We want everybody's input. We're going to talk about it at the next meeting, or however you want to do it. But I think that would be a better move than to have just a form of a code of conduct.
Oh,
Yeah.
yeah, I agree. I guess I just like to have something as a touch point to see what some other people are doing. But I agree with you. Having them develop it is really important.
It also gets you to know that their personalities more too. It also helps
Oh.
them you're also empowering them to be a leader in this family council, because when you want somebody to step up to that leadership plate, you're kind of already setting the seeds for them, because they're helping develop the code of conduct.
Yes, thank you very much.
Angela,
I-
thanks for sharing.
I have
Yes.
some questions and remarks. I think I mentioned in a previous meeting that we're still doing our family council via Zoom. which was a good idea during COVID, but I'm realizing now that I have trouble getting, it's mostly people that are not close enough to the facility. So it's good for them. But the people in the facility, they're not going to go home to get on the Zoom call. So I'm actually just listening. I realized, well, maybe I can get the facility to do the Zoom in a room where they could meet.
Yes, a
So-
hybrid.
Yeah.
Actually, Gloria and I have been dealing with family councils that are now doing hybrids, and it's been
Yeah.
successful, and everyone feels included.
Yeah, I'm going to bring that up when I go in tomorrow. But the other thing with ours, it's still hard to get anyone who really wants to be in charge. It's always been run by, well, at least as long as I've been there, by management. And then we did start getting, the first half hour would only be the family group. But there's so few that get on. I mean, sometimes it's good that brand new people, so it gives me a chance to talk to them about the role of family council and of the ombudsman. But it's hard to get anyone that wants to take responsibility for it. They would love for me to do it. I'm saying it's not my role.
It's not your role. I have to say though, just knowing the residents that that you're talking about, and being on several of those calls over the last 4 years, your family council calls, I don't see a lot of reason for them. There's not a lot of reason to complain, right? I mean, people are happy, the residents are taken care of. It is a wonderful long-term care home. It really is. I can't say.
The major complaint is lack of staff. Lack of staff can affect everything. And they
Yes.
have turnover like everyone else. They do, they really work at getting, they had an open house for employment last week. They do the training in-house for all the aides, and just keeping people is hard.
Cynthia, how are they, so how are the residents feeling about the lack of staff?
They complain to me all the time. It's mostly having to wait a long time. Night staff, not having enough people at night. Every once in a while I do hear stories which make me really get mad. One woman said she lives very close to the facility. Her husband doesn't sleep well, so she came in late at night and she found the aide sleeping in someone else's room. So, of course, those I report, but other than that, they say this. Some of the people, some of the residents, they say, "Oh, I hate to complain. They worked so hard," you know. So we just
So how can family council work with the residents and the facility? How do you think that might work? That might help. I'm not saying it would work. I'm saying, is that a possibility where family council might pull together? And understanding that if management was first running it, that there might be some hesitation to make it any different. I definitely hear what you're saying there. Sometimes when management has run it for a long time, then the families just become complacent. You know, they're doing the best they can. I don't always know what
no,
that
I
means.
don't think being complacent is the right word. We do have senior management that is very open door policy. And about a week and a half ago, I came in to talk to a lady and she says, "I'm so mad." She says, I'm not going to name names, but she says, "I'm going to go and see the director of nursing and talk to him." And I went back early this week and I said, "Was your conversation with him helpful?" And she said, "Yes." So they always say in the family council, if you have an issue, you don't have to wait for family council.
Right.
Just, you know, you can go to someone right away.
So what are the goals of the family council? What is the goals of when the like what is the goal for the family council? What are they working towards?
Nothing in particular.
Okay.
Cynthia?
So,
Yes.
Yeah.
Hi, I'm Linda. Am I understanding you correctly in saying that when you're saying that management of the facility runs the family council?
Yes.
I find that very odd, actually.
that's because there's been no one that wanted to step forward to do it. So, you know, they actually, the director of social work starts it off. We usually have either the head director or the assistant director talk about how things are going in the facility. And I keep meaning to tell him, quit telling them how many people you've brought in, please. But they're proud of that. We're at 98%.
That's a point of pride for him. Yep.
It is, and they have a waiting list, but that doesn't help when they're saying, we don't have enough staff.
Right.
And anyway, he does tell them what they're doing. He does fundraising. He goes to Washington and just, you know, all the good things about the home. We have a question and answer period afterwards. And, you know, if someone brings up something's personal, he's always saying, I'll stay after and talk to you. They definitely tamp down. Nope. You know, we don't want to get into specifics with people. You know, if you have a problem, come see me or go see someone else.
Right.
Cynthia, did anyone ever develop a mission statement, like guidelines that you want to operate under?
I don't know. We have it for the resident council and it was just renewed. I'm going to find out the next time I go in.
Let me just kind of clarify who I am. We recently started a family council for an Alzheimer's and dementia care facility. And we had we've actually had 3 meetings that we meet once a month. And the first meeting, the county ombudsman came and told us the benefits of having a family council and what we could expect with a family council, and kind of just offered guidance because the families were new, and we needed guidance and direction. So one of the at the end of the first meeting that was in February, she asked who would like to chair the meeting because the ombudsman cannot chair the meeting. It has to be run by a family member. And because it is a dementia and Alzheimer's facility, we really are the voices for the residents. They have, you know, the residents council, but it's pretty much, do you like the food? And everybody goes yes or no. And do you like the activities? And they go yes or no. So, you know, when there's major issues, it really is the families that need to address that with management. So that's kind of where we came into play and why we wanted a family council, because we identified a lot of issues that were kind of really detrimental to the residents there, and they didn't know how to speak up for themselves. So, you know, that's kind of where we came into play. So we had our first official meeting in March. We had our second meeting just last evening. And I really like the code of conduct thing though, because I think because we did develop a list of questions that we want to address with the executive director of the facility. And it kind of is good that the 2 people in the health department and the executive director and the council all officially started together in February as new people on the block. So we do see that the executive director kind of wants to network and work with us. So we're getting some really positive feedback that is really beneficial to the council to have an executive director that wants to work with you. She actually sends out, because I'm a co-chair and I just ask her if she'll send out, because she has the email addresses of all the residents. And so she sends out the reminder a couple of days or at most a week before the meeting for the council. And because it is a state mandate that if the families want a council, the facility has to send out the meeting announcement or post it someplace on the facility and provide a meeting room. So this facility has been very cooperative. And I hope, and she approached me just a couple of days ago and said, I've been waiting for you to invite me to your council meeting. So she opened the door and I said, we wanted to invite her, but first of all, we wanted to know what we wanted to invite her to ask her.
Great.
So we worked on that last evening, and I will be sending her a very respectful, formal letter with questions that we want her to address for us and answer, with plenty of time for her to look up data and do any kind of research on numbers, and because there are some questions that involve that kind of information. So I don't want to take up the time of everybody.
Linda, that's great information. And yes, definitely great information that you just shared with everybody.
Would you
And
look
it
at
does
our
sound-
mission statement? I'm kind of proud of our group. We started out with like 10 families that came to our very first meeting, which the ombudsman said was pretty much unheard of. So we were just like really, really pleased with that.
Are you in New York, Linda?
Yes.
Okay.
So the mission, are most of you in New York?
Oh, yeah.
Yep.
So the mission statement is to hold responsible parties accountable that all residents are ensured dignity and quality of life in a safe environment. Short and sweet, but and that's kind of how we wanted to keep it, because it says it all right there. We want quality of life and dignity for our loved ones in a safe environment.
Yeah, that's great.
Yeah.
Very good. Thank you. Great
You're-
successes there. You have some good successes. I think you have
Yeah.
success being that the administration respects who you are and is letting you run your family council, but yet didn't like barge in, or where, she's waiting for you to invite her or him. So that's great, right? So yeah, definitely have some successes there. And you're right about the mission statement. I think two important things are a mission statement, so the family knows what the family council knows what they're working for or towards. Also, it's easy to share with families if you have a mission statement, as this is what our family council is. Yes.
Exactly.
This, and the code of conduct that Lisa also mentioned, that is definitely important, because you are going to get some families who are going to take over your meeting, right? So you want to have some way to hold back in the
Keep it reined in.
reins. Right, exactly.
And I
So
think the
those
key
are-
word, and I think I said that when I told you that I was going to write a letter, with our questions to the executive director. I think the word is respectful.
Yes,
I want to write a respectful letter, and we do value her input, and she has come to me so many different times, and since she's been there, regarding the council, and sharing different things with me. So I know that she also respects the workings of the council as well. So
Lynn-
I continue that, have it be, beneficial both ways. Hopefully we can give input to them. And the other thing I think with the code of conduct, because I want to make sure that everybody is respectful. And when different management people come to our meeting, because we also want people from the healthcare office as well, to come and, tell us about their roles and what we can come to them for. So I think I don't want anybody to feel like they're under attack.
right.
And we do spend probably, our meeting actually has been running like an hour and a half. And just because people just have so much input and things they want to talk about and share. But I think we need to limit, and I really appreciated Lisa speaking about this too. I think I really want to limit the complaint time. And I want to kind of take the other half of the complaint time and use it so that we can talk about positive things that we see that have happened within the facility. Because I think the new executive director is really trying. She's only been there a short time. And a lot of the things, and there's still issues, don't get me wrong, there's still
Mhm. Yep.
that need to be addressed. But I've also seen, and the other family members have also seen, some positive changes that she's instituted since she's been the executive director. So I think we need to keep it on an even balance.
Linda, do you have just one question for you? Do you have an agenda that you go by?
Oh, yeah.
Okay,
And there's
so your
minutes.
agenda is going to kind of have new business, old business, and then
Absolutely.
Great, awesome,
do,
because that'll keep it kind of like on the, you know, you can use that to kind of pull in your reins and keep it going to where you want it, being more on the positive with less. You want to hear the complaints, but you want to give it a specific time, right? You don't want it to
exactly.
overtake the meeting. You want it to be more productive, more. I also think with the code of conduct, I think it was, I can't remember who said this, was that I think your code of conduct will also help when, how your audience, your families are talking to your staff or administration, right? So if we all have a code of conduct that we're all going to respect each other and, you know, be respectful of what each other is saying, as well as whoever is presenting or answering questions, I think that's also a good educational tool to help families know that we have to respect the person who's talking, whether they're in that family council or whether they're on the floor trying to address the situation, right? Because that's how you get things done, with respecting each other. Great.
Right.
Lisa, just want to say something on your note about that. It sounded like a management-led town hall versus a family council, and that I believe was for I forget
Cynthia Albanese.
Cynthia, yeah. So Cynthia, yeah. So it might seem like the town hall led by the administration. And you know, I don't know, Cynthia, if you or there's so many ideas that I have in my head, but you know, maybe just ask the family council, let's just have a meeting by ourselves. Let's not bring administration in. Let's just sit here and talk about the structure of the family council, and maybe, you know, develop some kind of structure with them. Be there to be the, you know, their sounding board, their brainstormer or whoever, but let them really do the putting it together putting the pieces together, because it is their council. You're absolutely right.
Yeah, I think right now it's hard for me because I don't have the email addresses or the phone numbers of the ones that call in. So I'm going to pursue trying to get the in-person going, and then we can do all that stuff.
Yeah, that's a good idea. And maybe have, you know, maybe look at the hybrid if you can. I don't know.
Oh,
if
yeah,
that would work.
yeah, that too. But in order, you know, to get them together for that, I can try on the next family council, but with the people all dispersed, you know, I don't know if I can do that. We've got them in California and upstate and the ones that
Right.
call in. So I'll work on the in-person one and
Yeah.
then combine it with the other one.
Thank you, Cynthia. Bruno, I think you were next, going to contribute to our discussion on success, or from the ombudsman perspective, how about family council?
Over the years, first of all, I have in my 2 counties, I cover 24 facilities. The majority are long-term care facilities. And I've started over the years 5 councils. Only 2 are still in existence, mostly because family members either don't have the time or there's a lack of leadership in the family council, and they just fade out. The 2 that are success. First of all, let me just back up a little bit. Mentioning the family councils that are run by the administrations, there's a goal behind that, and most of them are to get a good control of what the issues are, and to be, you know, to have a heads up on it so they can deal with them instead of having them as complaints. But one of the things that I've tried to stress in the existing councils that I still work with is there's a lot of complaints. People come in, even if you have an agenda, there's always someone voicing some complaint or another, and they have to vent. And most of them are fairly legit complaints. There's a procedure called a grievance file on all of these facilities. And one of the things that they always talk about, the complainants talk about, is fear of retaliation. So there's always power in numbers. I'm sure most of you have heard that. And as a group, as a family council, I try to get them to look at similar complaints, typical complaints, for example, staffing or dietary issues, and try to come up with a grievance complaint before you go to State Department of Health and so on, but have a grievance complaint that is signed by as many family counselors as possible, so that there is no retaliation possible for everyone who's part of the family group. That works as long as they're willing to have someone run the program and develop a complaint. I've done this. I'm sorry, I'm losing my voice here. There's some allergies with pollen or something. I don't know what it is. But I've tried to get leaders to develop something, and that's very difficult to do. I've run councils for a little while now, and I know it's not my job to do so, but sometimes it's the only way to keep one going. I've just lost one only because 2 people were left in the group, and it wasn't worth having the council. They weren't participating, and they lost a family member in the facility. So I've got some positive things about family councils and some negative things. It is difficult. And most of the things that we talked about here in this group is you need to be persistent. And there's going to be downs and ups and downs. You know, you've mentioned this before, Gloria. There are going to be ups and downs. And right now, Janine, you know, one lady that I'm talking about right here at one of the nursing homes, she's having doubts herself about continuing because no one else in the group, and we have between 12 and 20 groups, 20 people in this group, and no one really wants to take any leadership, not even to develop schedules and so on. So this one lady is going to be leaving. She's going to be sending out a message to the entire group to see if anyone else wants to do it. I'm not going to be able to do it. I've got other issues to contend with, but if no one takes over, that'll be a dying facility too. I'm not sure where to go from there.
Well, I can tell you, Bruno, I spoke to this young woman that you're speaking of earlier this week, actually last week. And I kind of blew some wind underneath her wings because we compared stories of my own family council and how I've been dealing with that, because it can be, it's off-putting to turn around and not see anyone that you can pass the baton to, right? You've got to, if it's a marathon, you need someone to pass that baton to. But I'm going to help her continue to work with her because she's not going to give up. It heartened her to hear that other people are going through this too. And it's not abnormal to turn around and not find someone to hand the baton to. So I'm going to touch base with her next week and see if I can help her. I had also suggested the hybrid meeting to her as an alternative, because Gloria and I have had 2 successes with it here in New York State, and it looks like even with our own family council, we're going to be doing that for my dad's nursing home. So it's probably the wave of the future, the trend of the future.
I've sent her the same kind of an email encouraging her not to give this up, because this last session was really poor. Complaints galore. There wasn't any acrimony within the group or anything. So anyway, it is hard, folks. If you want to run a family council, if you're very lucky if you have one that has total participation and willingness of people to actually accomplish something. You know, I try to get, for example, programs that activities lacking in facilities. Well, you know, I told some of these family council members, there's a volunteer program in the facility. Get trained to feed people, get trained to do some activities. And in spite of my asking them, it just doesn't happen. It's a tough thing. Very hard. Yep.
But we're going to keep on trying.
Yep.
Because
That's all you
we
can
will
do.
succeed.
Yep. Yep.
Thank you, Bruno. Thank you.
Okay.
Gilbert, if you still have your hand up, we would love to hear from you.
I just want to ask Cynthia if she has ever witnessed the change or shift when the CNAs are being addressed, or the change or shift, because that would provide some information as to why they have a high turnover. I have noticed over the years that the best way to run a home is to treat the CNAs with a great deal of respect and to make them leaders within their own units. And if you do that, you minimize the turnover. If you don't do that and you tell them what to do and how to do it, then you have a very high turnover, regardless of how good the management is. And I consider that to be very poor management, because if you treat everybody with respect in your facility, you will get much better, output from everybody. If you treat the cleaning ladies, the food people, the CNAs, as you treat the RNs, you're running a good facility and you will have minimum turnover. So that's what I noticed the most. And so I like to be there at 3 o'clock in the afternoon or 11 o'clock at night to see how the change of shift takes place. And I would, if I could, Cynthia, I would try to be there at 3 o'clock, so on, and just kind of observe how management treats the CNAs.
Gilbert, that I'm not quite sure what I'm there very frequently around 3 o'clock, and what I notice is that a lot of the CNAs are waiting by the elevators where they get to log out.
Yeah.
And that's kind of the opposite of them being important.
Yeah.
So when you just watch how the nurses talk during shift change, who they talk to, what they say, that sort of thing.
Yes, but also remember something. The CNA who's in charge of me from 7 o'clock in the morning until 3 o'clock in the afternoon has to turn me over to the CNA who's taking care of me from 3 to 11. So it's not just the nurse who's doing the directions, it's from one CNA to the other one. That's where the respect is.
Got you. Yes, that
Gilbert,
would be very important and informative. I will make a point of doing that tomorrow.
It would be, and Gilbert, I don't know if that even exists anymore in some nursing homes, because for a lot of the facilities that I have visited over time, the 7 to 3 CNAs are like Cynthia said, they're standing by the door, the elevator, waiting to either catch a bus or do something. The 3 to 11 CNA has already come in. They're either sitting behind the nurse's station or in the kitchen, or so there is none. And I think that is a culture change that may have to happen at some point in time, because I don't believe that the culture, I mean, I worked in a nursing home like years ago, and yes, all my CNAs, all my aides were involved in report. They heard everything about the patients. They knew all the patients because we went through every single patient during report. That doesn't happen anymore. It's nurse to nurse, and the CNAs are on the unit. So they don't even get that much information about residents and what's going on. It's a good practice that they did, but I think that's going to be a big culture change. But thank you for definitely I would love to see that come back, seriously, because it was very helpful.
I think a reason that might happen is that the CNAs have to put all their data in the laptop or whatever it is before they leave, and that's how they're transferring it instead of talking to them. But maybe both would be best. Like so and so had a bad day, or
give them a voice.
Yeah,
I agree.
And and Cynthia, you know what? Maybe it's like whenever you're like investigating or interviewing or questioning something, maybe that's a question you kind of ask either a unit manager or a DON. How does like the day CNA transfer information about the resident to the evening CNA? Maybe it's just right now just a pie in the sky question that you're going to ask just to give you some information. So it's a great thing it's a culture change, and we can work for culture change. We just have to know how to go about it. So Janine,
Uh,
I think what a
Lisa
great,
Dawson.
Yep.
Oh, we've got one more, just Lisa Dawson wanted to say something.
I just wanted to say that what Gloria was talking about in her years experience past can be considered very valuable. For example, in British Columbia, in the jurisdictions that are publicly funded, so the long-term care homes, for example, that are publicly funded, owner operated by the health authority or contracted to them, they all have to do those two things on both shift changes. They have to enter the data in point click care or whatever the named electronic program is that is now mandatory. It's, there's no more paper
Right.
charts anymore. They do all their charting in point click care. So they huddle. They call them the huddles on the shift change. And yeah, they're talking about who had the bowel movement and who's improved, whose baseline's moved, who needs this, who needs that. And they're doing it I observe it, it's it's all the time, every shift change. So it's probably no more than 15 minutes, but both shifts are there. They are talking, they are cross-pollinating, they are entering their data in their on their iPads into the program. They're doing what they need to do, but there is cross-pollination. Everybody does it. Nurse to nurse, CNL, whatever you call yours, ours are CNLs, same thing. And it makes a world of a difference. And if family council ever observed that, or if families of councils ever observed that this wasn't being done, that this information exchange wasn't being done, we have our, that's why we have a voice, right? That's why we have regular meetings with our senior leadership. Now, I know that some family councils have meetings only with a staff liaison person, a recreation or social worker person, and that person's a go-between them and management. I tell you, that doesn't work. It's not for the long run unless you've got a really, really small care home, because honestly, it's best to have even a meeting every 2 months with your senior leadership team, people who can make the decisions there in the room, answer your questions, and work with the departments and managers to affect change. So that's how we operate. And going back just to somebody else's comment with regards to recognizing staff, I feel very earnestly that all family councils should be involved in whatever their long-term care staff recognition program is. And now maybe your long-term care home doesn't have a staff recognition program. That would be sad. But our family council really contributes to nominating people. We have this online nomination thing, and they just get a nice certificate. It's nicely presented, and it's every month. It's a special life celebration day. We celebrate the staff, and they get donuts and coffee, and there's recognition in the lobby, and there's always someone from family council there, typically me, but nonetheless, someone to be the representative and to give thanks. And we do, for often really, really small things that people have done, but have made an impact either to their loved one or to the community as a whole. So I think that we need to always keep on our agenda a kudos corner or a recognition item on the agenda where we say something positive. Don't forget we have minutes, and our management team reads our minutes, so they never bother us about it, or at least they're well prepared if we come to talk when we come to talk to them every couple of months. So yeah,
That's an excellent suggestion. A kudos corner.
That is great. And I like the huddle. And honestly, I think if family council looked at those things and started advocating, it would be so empowering to the CNAs to feel like they are contributing to that resident's care and not just there to answer call bells and everything. Janine and Lisa, thank you. Janine, we've had a great session today. Thank you everyone for everything. Speaking up, sharing, the whole 9 yards. It was just, yes, thanks for joining us. And as always, please check out the Family Council Empowerment resource on LTCCC's nursingHome411.org. There's all kinds of things there. And
Lori and I are here for you. We offer a free Zoom room. If you need a Zoom room for your family council meetings, please work with us on that, we're happy to help you sign up for that. And we're here for you just to listen and to guide you if you hit some roadblocks. If you have questions that you don't know where to ask, we're the people here for you, and it's free, and it's for the betterment of everyone living in a long-term care facility and the residents. So thank you for joining us today. As Haley put in the chat, join us for the May program. LCCCC has a wonderful webinar every month alongside ours, of course. And it's worth your while to sign up, even just to get the recording of it afterwards.
Thank you.
Thanks, everybody.
Thank you.
Thank you all.
Bye-bye.
Thank you.
Bye-bye.
Bye. See you next month. Thank you.